Hello everyone, this is Subrat again, and I'm the non-surgical drug-free pain expert. So I got this question all the time, and this is our new question for this week. So the question was, is having a carpal tunnel surgery is a good idea or it is not going to be a good idea? So if you somehow have tingling or numbness in your hand, you talk to your friends or family, they'll quickly say, oh, your hand is getting numb when you sleep or it hurts. So you probably have carpal tunnel. That is a very, very quick answer. So you're probably going to ignore it. Sometimes you'll have pain all over the hand, or sometimes you have on this side of your hand, and sometimes it's going to feel numb. And especially when you get up in the morning, it is going to feel that way. So if you can deal with it, you can deal with it, or if you cannot deal with it, sometimes you're going to drop stuff when you are trying to pick up a jug of water, or you are trying to drink tea or coffee, so you might feel a little bit weak. You'll have hard to cut vegetable or to do any kind of thing to do with the hand, or if it's going to bother you, then of course, anybody who asks, they'll quickly say, oh, you have carpal tunnel problem. Then what you do, you probably go to your physician, and then they will do something called as a nerve conduction velocity. Now, if you don't know what that is, what they do, they test how quickly the nerve can conduct. So they pick up. So if there is a signal which is kind of a little bit low, so these will be pick up, and they will say, well, the nerve is not conducting well. So this nerve, what you are talking about, it is a huge nerve. It comes all the way back from here and crosses all over the arm, and they supply it to your hand. So obviously, if your hand has a problem, we already got programmed, then your hand has a problem because of the nerve. It is not supplying. So maybe they will be suggested quickly, you need to have a surgery on the wrist. And many of you probably heard this story, maybe yourself gone through this. So if you are one of them, already had carpal tunnel surgery, so please comment. I'd like to know if you had a surgery, how that went through that, and what is going on right now. Are you better? You are same? You are worse? I'd like to know. But then I'm going to say always carpal tunnel may not be because of the wrist. That is exactly what I'm trying to explain today. So if the carpal tunnel is because of your wrist, then obviously if you fix it, then your symptom goes away. But that is not actually true. And now how much that is not true? 98% of the time, if you have a carpal tunnel surgery, that is not going to work for you. But here in this video, I'm trying to explain what is going on here. So why the carpal tunnel surgery does not work. Before we get there, we need to understand what is going on here. So we basically have three nerves that comes and supplies your whole arm, including your hand. So there are two comes on this side. We call this as the palmar side. You don't have to be very technical, and I'm not going to get into technical detail. So basically two nerves supply on this side, and there is another nerve supply on this side. So there are three nerves they supply. So any kind of symptom happens. It can be numbness in your hand, can be tingling. Some people will complain like burning, like they touch something like spicy, how they have a burning sensation. Anybody who's going to complain that. Sometimes it may not be hand, maybe sometime in the forearm, but it is the reason is the same. Does not really matter. Or many people will complain right here, numbness, tingling, or on this arm, but the cause is the same. So these are the nerve which starts somewhere here. Let me show you. It comes from the spine here, then it crosses, and sometimes it comes through below your clavicle, then it goes here to supply. So let me ask you this. For example, you have a garden hose which is connected somewhere to a tap and the water is not coming down. So I can ask you, where is the kink? So kink can be anywhere. So it does not matter, only if we are thinking like at the end, the water is not coming, the kink is right there. That is not true. So if that is a nerve kink is going on any over the arm, that is exactly where the problem is. So that problem can happen not because of only the wrist. So this is exactly what I'm trying to explain it to you today. So let me demonstrate to you today, right now. So for whatever reason, the nerve can get compressed over here. It can be compressed over anywhere throughout the course. So how in the world this is going to get compressed over here? Let me demonstrate to you a little bit more. So here is Tara. She is a physical therapy assistant. I'm going to show it to you. So I said the problem can be anywhere starting from here all the way down. So imagine she is straight. Now for whatever reason her posture has changed. Obviously things are here getting tight and tight and tight. So if the problem is because of that, no matter how many surgery you do here, it is not going to get done. But can problem happen in the wrist? Yes, it can. Thank you. Yes, it can. It can happen only because of trauma. Like suppose you had fallen, have a wrist fracture. Can that happen? Yes, it can happen. So because of the wrist fracture, the wrist bones are not joined properly, or you have some deformity, some problem is going on in your wrist. That is the time it can actually compress your nerve, but not most of the time. Most of the people you are watching this, you think about this. Did you ever had a wrist fracture? So if you had a wrist fracture in the past, if you have a carpal tunnel surgery following that, maybe it is going to work for you. But if you never had a wrist fracture and your problem is bilateral, not only one happening, it is happening on both the wrists, the chances are there the problem is not on the wrist. The problem is elsewhere. When the problem is elsewhere, having a wrist surgery for carpal tunnel, that does not work. So how that is going to go? First, they will do the surgery on your wrist and it did not work. So then that is another thing called as the ulnar release. They will do this surgery over here. That may not work. You won't believe how many patients I see here every single day. They have been through this medical merry-go-round. They already have 1 surgery, 2 surgery, 3 surgery, 4 surgery, and it goes on again and again and again. So this is a big topic. I'm going to continue in my next video. So if you like, so please click like, or you can share with your friends and family. It might help them to avoid many surgery. So I'm not saying surgery is good or bad, but it has to be done for the right reason. But if it's not happening for the right reason, you are getting into unnecessary trouble and there is no end to this. This is the reason you guys inspire me to do all these videos. So please click like and share with your friends and family. So hopefully you are going to help them. Thank you, and I'm going to see you in my next video. Thank you very much.